Radin was such a lovely donation. I mean, what a gift to the women of the Valley.
Radin is a jewel in the Valley.
I don't think even the Laos knew what impact that donation by the Radin Foundation would make for this facility and for this region.
For the last decade, the team at the Marjorie E. Radin Breast Care Center at Clovis Community has lived those words, giving hope, easing stress, and healing Valley women.
I was diagnosed with kind of a rare cancer.
Mary Stoll knows firsthand what it's like to get the news that every woman fears.
That day was kind of a blur.
She was shocked.
And they helped me through one of the not fun, most memorable days of my life, telling me I had breast cancer.
Nurse coordinator Beverly McCann guided Mary through some dark days.
I looked at Bev and I said, this can't be happening because I'm going to die of a heart attack. That is my family health history. And she said, oh, you'll probably get your chance to die of a heart attack, but right now we're gonna get you through this. And so it was kind of at that point that I started to relax.
Mary had a double mastectomy, chemotherapy, and breast reconstruction. Throughout it all, McCann and the Radin team were right by her side.
I would have been lost. Stress and anxiety was reduced quite a lot during my treatment because of what Radin does. By having a multidisciplinary clinic, it was so nice sitting in one room and having the doctors come to my husband and myself. I knew they had seen each other and they had discussed my case, and yet when they came to my room, they were very interested in what I want.
It was this ambitious idea a decade ago that changed the face of breast cancer care in the Valley.
We began Radin because what we saw was that women of the Valley who had breast cancer were feeling the need to leave our local facilities and go to San Francisco, Los Angeles to get a multidisciplinary approach. So we started all talking about it, all the disciplines, radiation oncology, medical oncology, and surgery, and said, we have all these pieces, let's put them together. And so that's where the clinic portion of Radin came about.
It's really kind of a unique situation where we have private practice doctors working in collaboration with the hospital, providing the support for a program that would typically be in an academic center.
Before, you would have to visit with the surgeon, visit with the radiation oncologist, visit with the medical oncologist, all at different times in different offices. And now not only do you get to speak to all those physicians at one time to make that plan forward, but you also have assistance with social services. We have our nurse navigators who help patients through that transition.
When I came to start to work, it was basically a mammogram machine, a stereotactic machine, and a hallway with a sign over it. And we took it from sort of a small volume and really over the years grew the program. So there was a lot of devotion and effort put into making this center a success.
Such a success that sometimes patients become employees, like Mary.
Thank you, Susan, for coming today. I think you'll do well. You're going to do very well in treatment. Thank you. Our job as nurse care coordinator is to help the unit, the technologists, and we give results to patients with doctor approval on their results of their biopsies. Sometimes I even tell them I'm kind of their little pit bull. I mean, if they need help with anything they can't get through because doctors' offices are busy, I can be a first contact for them.
They know that that person has their best interest at heart and kind of knows the whole story about them, not just one piece, the whole story. And I think that that really makes the patients feel that someone really cares and that someone is really looking out for their best interest.
From the first 10 years of making a difference to the next, the best is yet to come.
We always have room to grow. There's always new technology, there's always new information about this disease, breast cancer, that we take care of. We always have room for making things even better for our patients.
I love these people that I work with. I would not hesitate to have them treat me. A building is a building, but it's the people that really make the experience for the women.